Seizure Basics by Amy Joyner, RN. What is a seizure? The brain is the center that controls and regulates all voluntary and involuntary responses in the body. It consists of nerve cells that normally communicate with each other through electrical activity. A seizure occurs when a part of the brain receives a burst of abnormal electrical signals that temporarily interrupts normal electrical brain function. Seizure classification. Seizures are classified into two groups. The first group is generalized seizures. Generalized seizures affect both sides of the brain. Absence seizures, sometimes called petit mal seizures, can cause rapid blinking or a few seconds of staring into space. Tonic-clonic seizures, also called grand mal seizures, can make a person cry out, lose consciousness, fall to the ground, or have muscles jerk or spasm. The person with this type of seizure may feel tired. Words that describe generalized seizures. Tonic. This is when muscles in the body become stiff. Atonic. When muscles in the body relax. Myoclonic. Short jerking in parts of the body. And clonic. Periods of shaking or jerking on parts of the body. The next group is focal seizures. Focal seizures are located in just one area of the brain. These seizures are also called partial seizures. A simple focal seizure affects a small part of the brain. These seizures can cause twitching or a change in sensation, such as a strange taste or smell. Complex focal seizures can make a person with epilepsy confused or dazed. This person will be unable to respond to questions or directions for up to a few minutes. Secondary generalized seizures begin in one part of the brain, but then spread to both sides of the brain. In other words, the person first has a focal seizure, followed by a generalized seizure. Seizures may last as long as a few minutes. Here is a good visual on what the brain looks like during a generalized seizure or a focal seizure. The signs of a seizure depend on the type of seizure. Sometimes it is hard to tell when a person is having a seizure. A person having a seizure may seem confused or look like they're staring at something that isn't there. Other seizures can cause a person to fall, shake, and become unaware of what's going on around them. Seizures may look different depending on the age of the child. Some warning signs of seizures may include odd feelings, often indescribable, unusual smells, tastes, or feelings, unusual experiences, out-of-body sensations, feeling detached, body looks or feels different, situations or people look unexpectedly familiar or strange, feeling spacey, fuzzy, or confused, periods of forgetfulness or memory lapses, daydreaming episodes, jerking movements of an arm, leg, or body, falling, tingling, numbness, or feelings of electricity in part of the body, headaches, unexplained confusion, sleepiness, or weakness, and losing control of urine or stool unexpectedly. Please review the following infographic on recognizing the signs of a seizure. What causes a seizure? The most common cause of seizures is epilepsy, but not every person who has a seizure has epilepsy. Epilepsy is associated with abnormal electrical activity in the brain. It may be due to an inherited genetic condition, trauma to the head, or diseases and developmental disorders of the brain. Sometimes seizures happen because of a high fever, which can be associated with an infection such as meningitis, infection, elevated blood glucose, lack of sleep, low blood sodium, which can happen with diuretic therapy, Medications, such as certain pain relievers, antidepressants, or smoking cessation therapies. Head trauma that can cause areas of the bleeding in the brain. Stroke, brain tumor, stress, bright lights, loud noises, illegal or recreational drugs, and alcohol abuse during times of withdrawal or extreme intoxication. The 3 stages of a seizure. The first stage is the aura stage. This is where you may see warning signs that a seizure is about to begin. The second stage is the ictus stage. This is the stage where the seizure is actually occurring. And the post-ictal stage is the recovery period. People recover differently. Some may recover in minutes, and some may recover in days. Your first priority when a seizure occurs is keeping your patient safe. This can include removing any harmful obstacles in the way, cushioning the head, timing the seizure, and putting the person in the recovery position once the seizure has stopped. First aid for seizures. First, you must recognize common symptoms. What does your patient's seizure look like? Next, you follow the first aid steps. This includes timing the seizure, speaking calmly, not grabbing on or holding tightly to your patient, blocking any hazards, and explaining to any others in the area what is happening. What to assess during a seizure? What time did the seizure start and stop? Time it with a watch if possible. Where in the body did the seizure start? The hands, arms, legs, eyes. Did the seizure stay in that part of the body or did it move to other areas? What type of movement did you see? Jerking, twitching, stiffness? Is there anything that might have triggered the seizure? Did the child experience anything unusual before the seizure started? Has there been a change in how often seizures happen or in this type of seizure activity? Seizures can often affect your patient's respiratory status. During the seizure, make sure you are checking respirations. Sometimes patients can have apnea. Check secretions. Does your patient need suctioning? Check oxygenation. What is the pulse ox reading if you have a pulse oximeter? And does the patient need oxygen? Always remember the airway. After a seizure, when your patient is stable, document on the Maxim seizure record as soon as possible. On this record, you will note the date, the time, the activity prior to the seizure, what was happening during the seizure, and what happens after the seizure. And you can make note of any unusual or different findings. Treatment for seizures. Medicine is the primary way in which seizures are controlled and is almost always the first therapy. Different medications help with different kinds of epilepsy and seizures. Medication controls seizures for about 7 out of 10 people living with a seizure disorder. Treatment continued. Dietary. The ketogenic diet is a special high-fat, low-carbohydrate diet that helps to control seizures in some people. The mechanisms or why it helps is not clearly known, but 10 to 15% of children on this diet typically become seizure-free, and 1 in 3 children will have a decrease in seizures. VNS, vagal nerve stimulator. This treats epilepsy that is not controlled by medicine. The stimulator device is placed under the skin in the chest area, and a small wire is wrapped around the vagus nerve in the neck. The device is programmed to stimulate the nerve regularly. It can give extra stimulation at the onset during a seizure with the use of a small magnet. Surgery. Surgery typically includes removal of the portion of the brain where the seizures occur. Clinical trials. Clinical trials are often being run on new medications or new procedures. And lastly, emergency treatment, Diastat, which we will discuss on the following slides. Diastat is used for prolonged seizures, typically seizures greater than 5 minutes. When using Diastat, be sure to follow the medication guidelines completely and thoroughly. How does Diastat work? Diastat is a type of medication called benzodiazepines. These medications have several effects on the body. They reduce anxiety, relax muscles, cause sleepiness, stop seizures, the mechanism, however, is unknown, and can impair short-term memory. When to use Diastat? Diastat Acutidyl is an at-home medication for patients 2 years of age or older who are already on stable anti-epileptic drug therapy, who require occasional use of diazepam to control increased seizure activity or prolonged breakthrough seizures. Please review this slide for Diastat child administration instructions. Seizure outcomes. How you respond to seizure activity has a direct correlation on your patient's outcome. Act promptly, be calm, be aware of the supplies you need, use your nursing assessment skills, and document accordingly. Time for a quiz. Let's see how much you know. Please answer true or false to the following. 1. Focal seizures involve both sides of the brain. 2. Diastat is used for seizures greater than 5 minutes. 3. Seizure first aid includes timing the seizure, staying calm, and keeping your patient safe. 4. The ketogenic diet is a diet high in carbohydrates. 5. If you have seizures, you have epilepsy. Also, please let us know what other topics would you like included in virtual training. Thank you for participating in this training. To get credit for this training, please email amjoiner@maxhealth.com when the training is completed. In your email, please include the name of the training, the answers to the quiz questions, which are on the previous page, and your name and title. A certificate of completion will be emailed to you. If you would like additional information on seizures, please contact your clinical supervisor. Thank you again for your participation. Your nursing care is so valuable to Maxim Woodbridge and to the families that we care for.